I'm Dr. Cece, owner and founder of Simply Well Chiropractic. And if you are here, you are a parent most likely looking for answers around autism, ADHD, maybe sensory processing disorder, or even seizures. And what I'm hoping is this will give you a little bit more information on how neurologically focused chiropractic care can help with some of these things. So, welcome to our little mini webinar of the perfect storm. If later on you would like to know more information and dive in a little bit deeper, we do host a perfect storm workshop webinar. So stay tuned for the end of that and you'll get the access as well. But what we are going to go through in this little mini webinar is just some overview information. So what is a perfect storm? How does this even take place? Some of the effects that can come from it. And then lastly, we hope to provide you with some hope. Again, you are most likely not alone in this. We have tons of families who have come to us kind of a last ditch effort. And we know that, and that's okay. But we hope that we can give you a little bit more hope in managing and really getting to the root of some of these issues. So again, hello. If you missed it, I'm Dr. Cece, and I'm the owner and founder of Simply Well Chiropractic. And Simply Well is a family-focused wellness practice. We focus heavily on pediatric, perinatal, and postpartum care. And so we are located in Seal Beach. And if you want to check us out a little bit more, we do have our Instagram handle there. That is a really great place to kind of just see our practice, see the families that we care for, and maybe even learn a little bit too along the way. So follow us there. So we are going to dive into this little mini webinar. I know you're probably pressed for time, so I want to be respectful of that. But what is the perfect storm? So in the context of a neurologically focused chiropractor, we view the perfect storm as all of the things that have gotten your child to this place where you're at right now. So again, in a lot of Western medicine, they are really trying to give you a one solid root answer as to why this may be happening, right? For seizures, it's genetics, or something worse. For sensory dysregulation, it's the gut. It's a cognitive delay. They're trying to give you a one-stop shop answer for what might be happening, and it's a very linear view, right? It's A plus B has caused C. And, unfortunately, in our experience, we have found that that is not the case. A lot of times, what have got you to this place with your child is an array of things that have happened that we're going to go over. So I hate to leave you in a cliffhanger, but we're going to go over it. So again, I've already kind of talked about what that typical problem is, right? You've been told that there is an A plus B has caused C. And maybe we have A, but we have C, but we don't know what B is, right? So the problem that we are seeing as a universal trend, no matter what, is that children and families are struggling with these things, right? They're struggling for connection. They're struggling for answers. They're really struggling through these diagnoses, these labels. And what the traditional solution has been for that is typically just more. They'll give you more therapies, they'll give you more protocols, more supplements to take, maybe even more labels for other access, more testing. And so what they are trying to do is give you more answers when in hindsight, they're really just missing the foundational aspect of what is happening with your child and with your health as a whole. So in chiropractic, we find that that missing link is your nervous system. Now, recently, your nervous system is getting a lot of traction within social media, right? There's all these nervous system practices and regulation. And so I'm really glad to see that people are coming on board. Unfortunately, they are still missing the link within your nervous system. And so we know that when stress is stuck within your nervous system, stress happens. That is where we are focusing. And the hard part for people to really get on board with, I think, is understanding how stress is also not linear, right? It's a diluted environmental thing. There's so many factors that come into stress. And when your nervous system can no longer really manage the stress that it's in, it's going to have some breakdowns. And so within pediatric chiropractic and neurologically focused care, we're going to look at stress. And we can see that stress starts as early as preconception. It can start early with mom. It can start during conception stress. Maybe we had fertility struggles. Often when we see these things come into place, we can almost I don't want to say for sure, but we can almost track the cascade that's going to happen from that. So often we start this process with fertility and pregnancy stress, right? We can see that stress has begun to set in this early on into the nervous system. Now, from there, typically we're going to have a cascade where medical intervention is maybe required, or that's just the option that we chose. That's also maybe where we were guided to go. And from that medical intervention, we're usually going to have a baby that's stressed and struggling, right? That could be with latching, feeding, any of the functions that a newborn should have kind of seamlessly, which is eating, pooping, and sleeping. Anytime we have an issue with any of those three functions, we know that stress has kind of set the stage. Once we kind of grow up a little bit older, then we'll have a toddler that's stressed, right? That's when we really start to see these things come into place. Maybe we missed a milestone or two. Maybe we were delayed. Maybe we weren't speaking as much as we should have by two. We're going to start to notice other stressors come into play. When we get a little further on, we're going to notice a kiddo that's struggling. Now we have the sensory ADHD diagnoses coming into play. And then we have a teenager that gets stressed out. And then eventually an adult that's burnt out. So again, this cascade is something that over time happens when stress gets stuck in our nervous system. And so what is the big whoop about your nervous system, right? Well, your nervous system is the root of your health. It is what controls every single function within your body, whether that be your gut, your heart, your respiratory, your cognitive, your social emotion. It controls every single aspect of your body. And so Dr. Bruce Lipton here described it perfectly, where the function of your nervous system is to perceive its environment and then coordinate appropriately, right? And it's not saying just coordinate actions or functions, it's coordinating your cells. So on a cellular level, your nervous system is functioning all the time. And when stress interferes with that function, we as pediatric chiropractors call that a subluxation. Now, subluxation is just meaning that your nervous system is not operating at its most efficient or at its most effective. And typically it's caused by stress. So within your nervous system, we focus a lot more on the branch known as your autonomic. So things that you don't think about that are always working in the background. And so within your autonomic nervous system, you are going to have two branches within that, we'll say. One of those branches is your fight or flight response, known as your sympathetic. So that's going to be your protective, get away from danger, I'm in survival state. And then you have your parasympathetic, known as your rest and digest, or your calming and growth state. Now, unfortunately, you can't be in both of these at the same time, and your nervous system is going to pick and choose what's the most important for your survival. When our nervous system perceives stress in our environment, it is going to shift into that protective state. And if you are aware of stress in your environment for long enough, you're going to stay stuck in that protective state. And your nervous system is going to get used to that and adapt to more stress. So that is where we start to see the stress cycle and cascade really take effect. Now, we find it a little bit easier to talk about stress in kind of the realms of a car, right? So you have your protective fight or flight response known as your gas pedal, right? You need to get away from danger. And then you have the brake pedal, which is that parasympathetic, that calm, restorative, take a pause area. And so what we have in this little odometer here is just a different way to look at stress. And so again, in chiropractic, we always focus on stress in three different categories. We're going to have physical stressors, chemical stressors, and even emotional stressors. So overall, people are very similar or very aware, I guess I should say, with the physical aspect of stress, of trauma, right? We get a fall, something has physically happened to us, where we often kind of forget there's a physical stressor isn't during that birth process. And oftentimes it's usually from cesarean. Cesareans are just, they're a little rough on mom and baby, unfortunately. There's not much more we can say to prevent that. They're necessary at times. Just like anything, there's a time and place. But it is a lot of force, and a lot of force typically at that upper cervical region where the brain and the spinal cord are going to start to meet. So again, physical stressors, usually the first thing we see with kiddos is a stressful or traumatic birth process. Chemically, that can go from anywhere from what we are putting in our environments, on our bodies, in our bodies, and emotional stress as well is a factor that our system has to accommodate and coordinate as well. So, what tends to happen is when your nervous system is overwhelmed with the stress in its environment, it's going to shift into that fight or flight. Now, again, your fight or flight is not a bad thing. There's a time and place for it. Unfortunately, when that becomes the new norm, we now get stuck in that stress cycle. And because we cannot be in growth and protection at the same time, your system's going to start to really put a lot more energy and focus onto that survival aspect. And it's going to take energy away from the growth and repair section. So, the missing link for these kiddos is that they are stuck in stress. They have been stuck in stress for a long time, and we're usually at this point coming into the awareness of the physical effects it's maybe having in our health, right? So now we have kiddos that are stuck in stress, but we're noticing that they don't sleep. Maybe they have a poor diet. They're not hungry. They just like will not eat. We also usually have a lot of digestion issues when it comes to kiddos that are stuck in stress. We'll have constipation, maybe even the opposite end when things are just not staying. And this all tells us that our children are stuck in stress. Stress has been playing a silent factor in the health of our kiddos for far too long. So how does this even take place, right? Because I told you earlier that this is not a linear process, right? It's not that you ate one too many cheeseburgers and now you're having digestive issues, right? This is something that has built up over time. And so, again, keeping that in mind, when it's built up over time, it's going to become a pattern within your system, right? When your nervous system is repeatedly exposed to something and that's the new norm, it becomes a pattern. You start to notice that as truth, it just gets reproduced like that. So, within stress in your nervous system, right, we are going to see how this can kind of set place when it comes to more like deep, or I should say higher neurological functions like developmental milestones, speech, cognitive delays. Because when we have that repeated stress come into contact with our nervous system, more so our neurospinal system, it's going to have a lack of movement. And that is the first adaptive process that we have. So again, a C-section, typically just because it's a lot of force on the upper cervical region, it's going to have a lack of movement there. From there, little ones will typically have like torticollis or trouble turning from side to side, and that might alter some type of latching or feeding process. But overall, that lack of movement is going to have a lack of perception or signaling within your nervous system. So again, your nervous system's job is to perceive its environment and then send that information accordingly. When we have a lack of movement, we aren't going to get proper signals in. What we're actually going to get is an increase in some signaling known as nociception, which is, you can kind of think of it as extra noise, right? We have a lot more coming in that we don't necessarily always need. That lack of perception within our system is also going to cause a lack of function. And we'll start to notice it first in those autonomic functions like your gut and your immune system. Lastly, that lack of function is going to start to impair the lack of output that we have. So that will be like speech, social behaviors, and maybe the emotional regulation as well. So that is generally how we see this cascade take effect. Now, I'm bypassing a lot of the processes that do go into this. Like I said, we do have a perfect storm workshop webinar that will dive into this a little bit more, and where you can maybe start to really piece together where this has happened. But ultimately, when we have that lack of movement in your neurospinal system, it's going to have a lack of sense or sensory input to the brain. And then the brain cannot adequately send that information out, which is going to cause lack of function in the organs and systems. And that is what we know as neurologically focused chiropractors as dysautonomia, right? There is a dysfunction within the autonomic systems within your nervous system. And so this is generally where we focus of regulating and getting that autonomic nervous system, that foundational aspect, regulated, functional, and efficient and adaptive, really, so that we can start to see better outcomes when it comes to maybe cognitive or developmental delays. So in utero, brains are usually built from the butt up, And this is where we kind of focus a lot on the neurospinal system to make sure that we can get that movement and perception into the nervous system appropriately. So again, we will go through that more in the Perfect Storm webinar, so make sure to register for that. But again, when we have that dysautonomia, there's few other functions within the system that come for that too, right? So again, lack of movement, lack of signals, lack of function. That's kind of the simple way to think about it. Within that, your nervous system has a lot of processes. So we call this the 10 Ds of interference or 10 Ds of dysfunction. You've most likely found us from PX. And if you have, Dr. Tony has talked a lot about this as well, that I'm sure you have already come into contact with. But we have dyskinesia, disaffrontation, dysautonomia, dyskinesis, developmental dyschesis, disruption, distortion, disconnection, dysregulation, and ultimately dysfunction within your nervous system. So again, these processes take time. And through all these processes, your nervous system is a dynamic organ that is always adapting and learning from these as well. So when it learns to move through these, it develops patterns to get through that. And breaking those patterns is where we get the best outcomes when it comes for these kiddos, right? That foundational change is what allows us to have these better outcomes long term. And so dyskinesia is a lack of movement in your neurospinal system. Again, we kind of already went over that a little bit more in depth. Disaffrontation is that abnormal input of information, sensory information typically. We finally get dysautonomia, and that's going to be where we focus primarily in the first phase of care. So dysautonomia is not only about, really managing symptoms, because in a lot of these cases, these are your cues as to why the nervous system is having a issue or a struggle, right? So we don't focus on chasing your symptoms. This is a byproduct of a deeper stress that's happening. What we really want to do is take care of that foundational root. So that this dyskinesis or this abnormal output of energy. And this is where we'll start to see things like fatigue, exhaustion, burnout, and maybe even anxiety, right? There's a disorganization within your nervous system. And so at Simply Well Chiropractic, what's really cool is that we have a technology to help us measure the outcomes and the efficiency of all these processes. So what we have is the insight scans, and what these will do is give us an inside look into your nervous system of how it's managing and regulating its current environment, right? So we can see the maybe dyskinesis, the abnormal energy output. We can see how you are managing your environment with that vagal nerve. We can see, again, how you're responding to your environment. And then we can also measure your autonomic function and see how that is affecting things as well. So lastly, again, I told you we were going to provide hope. Simply Well Chiropractic is a place for families for hope. We know we're usually the last stop shop. We know that you have been through the gamut with a lot of these things. And we also know that you are probably feeling a little discouraged at the moment too. And so I would like you just to, again, I urge you to really come to the Perfect Storm workshop or the webinar that we have, where you'll get a lot more answers and a lot more input. But knowing that we have the tools needed to just be as effective and as quickly transparent when it comes to stress within your nervous system is one of the benefits that our team has. And I'm just so excited. I was like, I wish I could tell you even more about, all the scanning tech CAs and everything that we have, because it really is an environment that is designed to be comfortable, be open, and be encouraging. But also kind of meet you where you're at. So often we get a lot of questions of, I don't think my kiddo will sit for those scans. What does it entail? And so the really cool thing with this is that our scans are really just reading what your nervous system is expressing at that moment. It's not putting any type of stimulation or radiation into your system. It is just reading what you're already currently managing. And so again, with a lot of our sensory kiddos, we meet them where we're at. We are going to do our best to get all of 3 of the scans that we can, but sometimes it's a lot of sensory input and sometimes we can't do that. And we can start with where we're at that moment too. The other thing is that they are generally fairly quick. So overall, the scans themselves take about 10 to 15 minutes. And once we have that information along with some of your maybe clinical history, we can develop a care plan to get you to your goals as effective and as quickly as possible while rewiring your nervous system to maintain that. So I'm so happy that you listened to our quick little webinar. Again, it's a lot to go over, but urge you to sign up for that perfect storm. And if you have any questions in the meantime of that, you are always welcome to give our office a call and speak with one of our team members to help guide you along the way. So I'm glad you're here and I can't wait to meet you.